US economy lost more than 20.5 million jobs in April, and 1.4 million of them were in healthcare, a sector that has historically been recession-proof. This chart shows employment numbers between 1990 and 2020. This downturn is the Great Recession, where millions of workers were laid off. You can see healthcare jobs continue to rise during that same period. And the same can be seen during other recessions too. But this time it's different, and experts say that the impact from the coronavirus crisis could fundamentally change the healthcare sector, and a lot of the jobs lost are not likely to return.
Healthcare has been among the most resilient industries in the economy, and there are really two reasons for this.
David Cutler is an economics professor at Harvard and has done a lot of work understanding how the medical system operates and how it responds to events like COVID-19.
One is because people have insurance, and second is because people's illness tends not to vary too much over expansions and recessions. Since the pandemic, anything that's not emergency, people have cut enormously. And even many emergencies, use of care for emergencies is way, way down.
To help the sector cope with the virus, some healthcare restrictions were relaxed as part of the $8.3 billion coronavirus stimulus package. That gave a big boost for different parts of the healthcare industry, including telemedicine, that saw one company report a 50% rise in telemed services.
Now people both in private insurance and in Medicare are using telemedicine a lot. It's hoped that that can then become a usual part of practice. On the scope of practice front, we enabled a lot of nurse practitioners, medical assistants, physicians assistants to do more. Now that we've done that, we want to be able to keep that. And the third one, which is really important, is most physicians' practices and hospitals get their money by doing more services. When people don't go to the doctor, the providers lose money. A way out of that is to pay on a fixed, say, per patient per month basis. And so that's another change people would like to see become a permanent change.
Another reason a rebound in healthcare will be harder than previous years is people's financial exposure to healthcare. Just looking at the last recession, and the out-of-pocket expenses were far less than what they are today.
If you're in a big recession and you now learn that you're going to pay $2,500 out of pocket before insurance pays anything, people may decide they're happier cutting back, particularly since they just had experience cutting back during the first phase of the COVID epidemic. If you then add on top of that what the potential for example, COVID to come back in the late summer or fall, and by that point, you really have people with a very different outlook for what they want in the medical system, providers in very different shape, and people in a financial situation where they may not want to go back to the care they were receiving.
Healthcare in the US continues to be one of the most debated issues among lawmakers and politicians, and on a global level, the US spends at least 17% of GDP on healthcare, whereas most other developed countries spend 50% less on average. So while it is critical for the US economy that healthcare rebounds and that it continues to provide care for those who regularly need it, economists are watching for signs that it emerges from the pandemic more streamlined.
So it's really a very bad idea to have a healthcare system that's bloated. They pay a lot and they don't get what they need. Now, the best way to deal with this is not to just shut everything off at once and lay off a ton of people, but to gradually do things so that you make that change. So what I would hope is that after we make it through the first part of the epidemic phase, we come back in a way that's more streamlined so that healthcare isn't as expensive. And then we help those people who we're not bringing back to find other really productive things they can do as well.